So hello everyone, my name is Tara, and before I launch into my presentation, I'd just like to take a moment to thank the Capital Regional District and Island Health for hosting my practicum. I would especially like to thank my practicum supervisors who have joined us here this afternoon, Melanie and Shannon. Thank you for taking time out of your day to be here. The staff and faculty at UVic and my peers for their support and for facilitating an incredible learning experience. I'd also like to acknowledge the traditional territory of the Coast Salish people on whose land I have the privilege to live and work. The Regional Outcomes Monitoring Collaborative, also known as the ROM Collaborative, is made up of representatives from local government, health authorities, community organizations, funders, and an academic institution. Established in 2013 with the goal of aligning resources and efforts to monitor the health and well-being outcomes in British Columbia's capital region. The ROM Collaborative takes a social determinants approach and is concerned with supporting equitable access to community resources and supports that contribute to the health and well-being of all residents. I like to think of this group as the worker bees. Bees, like the ROM Collaborative, are challenged to balance the role of individuals relative to the communal good. On a continuum between the personal and the collective, bees very much favor their community. For my practicum, I was asked to research and compile a robust set of indicators for 5 identified priority areas, and they include connection to arts and culture, economic security, inclusive connected communities, lifelong learning, recreation, and active living. I was further tasked with applying an equity lens to this work. I believe applying an equity lens requires thoughtful consideration to supports that invite participation from populations that are not traditionally represented in mainstream initiatives. Indigenous people, youth, rural residents, just to name a few. It's also about addressing the complex interplay of the social determinants of health and their impact on health. Applying an equity lens to this work is important because the ultimate goal of the ROM Collaborative is to create a community where all residents of the capital region are able to thrive. So think about it as a healthy, symbiotic ecosystem where biodiversity is thriving. As I started my research, which included reviewing published data sets, academic articles, gray literature, and information gleaned from subject matter experts, the concept of a health in all policies approach kept appearing in the literature. This approach refers to an accounting of health and equity in the policies of sectors that influence health. So examples could be economic policies, education, housing. It also presents an opportunity for public health practitioners to enhance collaboration with non-traditional partners and integrate health considerations into systems and decisions outside the health sector. I realize that the ROM Collaborative is uniquely positioned and structured to provide leadership for a health in all policies approach in the region. Another way to think about it is similarly to how bees transfer pollen from flower to flower, the work of the ROM Collaborative establishes a model and pathway for this cross-pollination or cross-sector work to happen in the capital region. Literature on community health indicator projects reveals a common limitation is a lack of available data and the costs of obtaining locally specific information. So an example was a foundational document for the lifelong learning priority area was UNESCO's Global Network of Learning Cities. A strength of this document was that it included indicators targeting potentially marginalized populations. However, a potential weakness was that many of the measures would require the development of a local survey, which could be costly and time-consuming. Another common critique of indicator projects is whether they inspire action from different actors outside the health sector. And I really saw this as a strength of the ROM collaborative, so I didn't think that would be a factor moving forward with this group. The third limitation was around consistency, and there's two parts to this. The first one being the process for indicator selection and exclusion should remain consistent over time in order to effectively assess change and impact in the community. The second part has to do with the reliance on third-party data. So it presents a potential risk because a third-party source could lose their funding and stop collecting data. They could alter their data collection methods. And I also found that data collection methods often vary between sources, which can be challenging when trying to compile data from multiple repositories. Like the bee depicted on this slide, the work of the ROM collaborative is very much future focused. And with that in mind, the key recommendations that I proposed for this suite of indicators include that they be, no pun intended, clearly defined that they be clearly defined and articulate the priority area in order to be understood by a wide audience, reflect community and stakeholder consultation, be supported by available and accessible data that is relatively simple to obtain and at a low cost, be measured over time to show trends in results, have regular, reliable data sources that are available on a region-wide scale, and as a data set, capture the intersections of the physical, personal, social, cultural, and economic factors that impact health and well-being. Taking the lead from other community indicator projects both within Canada and abroad, traditional next steps include broad community consultation to determine what the community feels is the most appropriate and useful indicators to track over time. Further refinement of the indicators selected within each priority area, and a final determination of which indicators will be tracked over time. This work requires one to become comfortable with imperfect data. So unfortunately, data was not always available for indicators identified as a priority. So for example, the literature suggests that with regards to recreation and active living, barriers to access include financial cost, physical proximity, culturally appropriate options, and perceived safety. However, it was challenging to compile a robust list of indicators around culturally appropriate activities, and so there are gaps. And when an indicator was found, I'm not certain that in practice it's actually measured or tracked. Although these gaps exist, there is evidence that more and more organizations are shifting to better address the inequities that exist in society. So, for example, the Canadian Parks and Recreation Association has come out with very broad objectives around pathways to wellness. The next step is developing indicators that will measure that I'm really hopeful about. However, they haven't been publicly released at this time. From a public health perspective, the weight of evidence suggests that the elimination of health inequities holds the key to the next great public health milestone. Much like the production of honey, the work of addressing health inequities requires a collective effort and simultaneous action on multiple fronts. There's a saying that it takes more than one bee to make honey, and in this case, the work is beyond the scope of the health sector. Ongoing measurement of the factors that enhance and diminish health is a critical aspect to moving towards a healthier and more equitable region, because often what is measured influences what actions are taken. So through extensive community consultation and careful selection of indicators, this initiative will be able to provide decision makers with the information needed to enact strategic plans, policies, and actions to ensure that all residents of the capital region are able to thrive. Thank you.
Thank you. Questions for Tara? Oh, I thought I saw a hand. I'm getting trained. As soon as I see a hand, I start moving. Any questions?
Please don't ask me anything about bees, because everything I know is...
Can you give us a hint of one of the indicators that might be used? Some of the actual measures?
Well, looking at to what other indicator projects have used and will probably, I'm guessing, be implemented in some way here, things like voter turnout, volunteerism, those seem quite common. I did have the opportunity to participate in some stakeholder engagement, and it was interesting that what people came out with in those discussions was also reflected in the literature as well. So that's encouraging.
Very interesting. Any other questions? No? Well, if not, thank you very much.
Thank you.
And we'll, yep, that's right. Applause, please.